IVF is a very common procedure nowadays, and there are so many misconceptions and queries patients ask us in the OPD. The most common myth or misconception they ask us is IVF means you are going to use somebody else's egg or somebody else's sperm. No, it's not like that. IVF is a procedure where we are helping you to conceive with your eggs and your husband's sperm. IVF is a procedure where if somebody else's eggs are less or husband's sperm count is less, still we can create a baby using your own eggs and your own sperm and give you a pregnancy. In case if there is a condition when we have to use somebody else's sperm or somebody else's egg, the center will inform you, take a consent without informing in this procedure we are not going to use somebody else's egg or somebody else's sperm. Another common misconception people will have, because you are using so many people's egg and sperm, how will you segregate my sperm or my egg from others? Is there any chance of mixing in that? So I would like to tell them that if you see or if you do your IVF in a very good quality control IVF labs, usually each case is kept separately. That means your eggs and sperms are kept in a separate petri dish, separate incubator, and which is marked for you. And usually in the standard IVF labs, two embryologists will take care of one case, and each case is kept separately into pre-marked petri dishes and incubators. So there is no chance of mixing of sperm and egg. So once you come to the IVF lab, you best assured that it will be your egg and sperm and your embryo which is put in. There is lot of quality control goes into it, and at Nova we take good care of that. Then many will think that IVF means during entire treatment I have to take rest, and if I get pregnant I have to be on bed rest for full 9 months. It's not like that. IVF treatment is very simple. It is mainly a OPD based treatment. Only on the day of egg collection you have to get admitted for half day. Rest during entire treatment you can work. Post embryo transfer you have to restrict your activity, and by God's grace if you get pregnant, then pregnancy is like any other pregnancy, where you will be put on little extra medications for first 2 months, and after that it depends on how your pregnancy is happening. Just because you have got pregnant by IVF, it doesn't mean that you need bed rest. It is the most common myth what people have when they are undergoing IVF treatment. So IVF pregnancy is no different from any other pregnancy, and you don't need bed rest during treatment or during entire 9 months of your pregnancy.